Hello all and welcome back. In today's episode, we're going to be exploring a supplement protocol for colds, flus, and COVID. I would just like to state that before making any changes to your diet or supplement routine, to please consult a healthcare professional and or your doctor. If you are taking any medication or are on any medication, please do not make any changes to taking your medication whatsoever. The information on this video is simply for educational purposes and is not and should not be substituted as medical advice. Now, throughout this episode, I will be referring to my notes a lot as I am reading several randomized controlled trials, and I want to make sure that I'm getting the mechanisms correct and the trials correct and not confusing them, having read them many times over. I hope this isn't too complicated, and I hope I've broken it down enough. If you have any questions or queries, please do leave them in the comments and I will try my best to answer them. So many people are coming to me saying that they've caught some kind of a flu or COVID, and it is that time of year where virulence for these airborne viruses are very high. So my aim of this video is to try and provide you with some supplemental tools that may help prophylactically or help shorten the duration of a cold, flu or COVID or lessen the symptoms. So vitamin D, zinc and quercetin are the foundational immune support supplements that I would recommend. We are now going to start touching upon some other supplements that are really good for preserving gut barrier integrity, which has a lot to do with immune support and function if you watch my previous microbiome video. So the first one that we're going to touch upon is L-Glutamine. So L-Glutamine is an amino acid. It's actually the most abundant amino acid in the body, and it's involved in many bodily functions such as immune support, energy production and tissue repair. So it's a major fuel source for immune cells, especially during inflammation, injury or infection. This is when it becomes a conditionally essential amino acid. So in particular, lymphocytes, neutrophils and macrophages actually consume L-glutamine in quite large amounts and at high rates, similar to or even greater than they do glucose. This is in order to generate energy and support their functions. So glutamine is essential for proliferation and activation of immune cells, allowing them to rapidly multiply and respond to infections. So it really does provide macrophages and neutrophils, which are the most phagocytic immune cells, meaning they engulf pathogens the best, which is so important for the immune response. When discussing doses of L-glutamine, between 5 and 10 grams daily, and it can be divided into different doses as you like throughout the day. That generally seems to be where the literature suggests. And in terms of timing, just daily supplementation as in it doesn't really matter. It's generally safe for most people and can be taken with or without food. So in summary, L-glutamine is the most abundant amino acid in the body, and it plays a key role in immune function and gut barrier integrity. It serves as a primary fuel source for immune cells like lymphocytes, macrophages and neutrophils, especially during infection, inflammation or any kind of injury. And it does this by supporting immune cell activity, maintaining the gut lining, and glutamine overall just helps strengthen the forefront line defenses against viral infections. So next up is vitamin A. Vitamin A is crucial for gut barrier integrity and tight junctions. So vitamin A helps maintain the expression of tight junction proteins in the intestinal epithelium, thus reducing gut permeability or leaky gut. It's also very important for the regulation of immune cells. So vitamin A is involved in immune cell activation, cytokine modulation and epithelial homeostasis. So vitamin A is essential for maintaining mucosal and epithelial health. It helps regulate cytokine production and supports innate and adaptive immunity. Vitamin A deficiency does lead to dysregulated cytokine profiles, weakened mucosal immunity, and increased susceptibility to infection. Anecdotally speaking, since I started taking cod liver oil, which is one of the highest sources of vitamin A, I've noticed that my immune strength has greatly improved. So with respect to dosing, prophylactically speaking, I do just recommend taking a spoonful of cod liver oil daily. Now, it's really important to note that really high levels of vitamin A can cause toxicity. So please don't overdo it. Remember that vitamin A is a fat-soluble vitamin, so it needs to be taken with a fatty meal. In summary, vitamin A is essential for the integrity of mucosal barriers of the gut lining and also the respiratory tract. It supports the expression of tight junction proteins that help reduce gut permeability, and it helps regulate immune cells to maintain balanced, effective immune responses. So adequate vitamin A levels are linked to stronger mucosal defenses and better protection against respiratory infections. Moving on, we're going to be discussing colostrum. Now, colostrum is essentially the mother's first milk of generally cows, The babies only tend to use about 6 to 11% of the milk, and the rest of it is discarded. So farmers decided to put it to good use and have made colostrum powder. So colostrum is really rich in immunoglobulins, particularly IgG and also sometimes IgA. It's also a rich source of growth factors, antimicrobial peptides, and various other bioactive compounds. So these all help with mucosal immunity in particular, neutralizing pathogens and enhancing repair. So to rattle it off, colostrum helps maintain and restore gut barrier integrity, it reduces gut permeability, it supports mucosal healing, it also boosts epithelial function. So colostrum does seem to modulate the immune response. It increases regulatory T cells in neonates, it improves lymphocyte function in the critically ill, and it also helps reduce infection severity. So there was a study entitled Effects on Recurrent Respiratory Tract Infections and Diarrhea in Children between 1 and 6 years old. So colostrum reportedly reduced episodes, urinary tract infections and diarrhea over follow-ups. It also improved tolerability and it resulted in fewer hospital visits. There was another study conducted entitled Colostrum in Acute Respiratory Failure, so in the critically ill and ventilated. So patients in the ICU had enteral feeding and colostrum versus control for 10 days. The colostrum group had higher CD4 and CD8 counts and lower incidences of ventilator-associated pneumonia and colostrum difficile diarrhea versus control. So generally, the dosing of colostrum is between 500 milligrams to a gram per day in capsules or powdered form. Timing-wise, during an illness or prophylactically, often for weeks and months, the timing during the day doesn't really matter. Something to note is that doses vary by product. Check for bovine colostrum with high immunoglobulin content. I have no affiliation with this company, but Armra Colostrum does a great one. In summary, colostrum provides immune supportive compounds like immunoglobulins and growth factors that help maintain gut barrier integrity, support mucosal healing, and modulate immune responses. Human studies suggest it can reduce upper respiratory infections and diarrhea in children, and improve immune markers and infection outcomes in the critically ill adults. Its role in both gut and immune function makes it a relevant consideration in broader immune support protocols. Thank you very much for sticking with me through that video. I hope that was useful to you. I will catch you in the next one, and that was Science Made Simple.